This is an interesting diagnostic laparoscopy. A young lady, 30 years, presented with us with ascites, tumor marker raised. So we proceeded with diagnostic laparoscopy. We found huge ascites and multiple peritoneal deposit over the small bowel, over the large bowel, all over the peritoneum. Here we can find our right diaphragm, our liver surface, our gallbladder. This is the falciform. All are involved with the peritoneal deposit. Here we can find also the left diaphragm also involved. This is the porta hepatis. Here you can clearly identify the porta is started with the multiple diseases. Then we look into the pelvis, and when we look into the pelvis we found the uterus is ventrofixed, both the tubes are studded, but there is no deposit on the POD. This is our rectum. Here you can find, and here the ends of the tube are studded with multiple deposit. Here the uterus is ventrofixed. Here you can clearly identify that. Now we proceeded with biopsy after that. So we take a biopsy from the parietal peritoneum. So in this type of cases we usually take a large chunk of tissue to get a good tissue diagnosis. So we take approximately 2 to 3 centimeter of a tissue to get this biopsy specimen. Here we are using our monopolar cautery, and we will give the traction with our grasper, and we are separating the peritoneum from the underlying tissue. So our monopolars are a very good instrument for this type of peritoneal biopsy, rather than go for only a punch peritoneal biopsy, which may be an incomplete as because the specimen will be very small. So here you can find clearly this is a large chunk of tissue, so that will be very good for the tissue diagnosis. So this is the last part where we are separating the peritoneum from the underlying structures. And once this is done, we put the specimen on top of the uterus. Here we can see that, yes, we are putting that on top of the uterus, and also after that we will take biopsy from the distal end of the fallopian tube also, as because the fallopian tube is studded with multiple peritoneal deposit. But surprisingly, the final biopsy report came to be as abdominal tuberculosis. So we thought in our OT it is a case of advanced ovarian malignancy, but surprisingly it came to be as tuberculosis. That is good for the patient. So this is the last part of the fallopian tube biopsy.